Okay, this is on BitChute. Probably don't have it. A lot of people don't have it. It's got a lot of good videos, just like X, and you don't want to sign up for that. And you don't want to go into TikTok, but really, you're missing out. There are a lot of information that you need to know. And here, this guy here was a nurse, and he was talking about the PCR machine and how they turned it up and they could find anything. That's why there were so many people in the early months of COVID, because the CDC told them to turn it up to 40, and then all of a sudden they turned it down to 30, and all of a sudden people weren't getting sick as often because the PCR machine is a lie, and it's the same machine that they're trying to tell you, excuse me, that we got chickens that are getting bird flu, and we got turkeys and pigs and cows and all the different flus that they can have, and they're telling you this. They want to starve your ass. Originally, they tried to kill your ass with the PCR machine, turning it up high. You need to watch this and share it long and hard. I'm trying to save the world. It ain't easy. And here you go.
All this stuff on PAPR, etc. Following the protocol, I didn't want to catch it. When I got off from work, I stripped down to my underwear and Crocs and went home. Okay? Second week there. Well, instead of 38 patients, we have 30. Next week, 24, 25. Next week, 15, 16. I said, wow, where's COVID going? They said, oh, well, it's just... So we're going to stay empty, 15 beds out of 38? And this is a COVID unit, bin COVID unit. All rooms were negative pressures. The hallways were built negative pressure. They didn't convert it. It was built that way. So if COVIDs are going to come into this hospital, this is probably the best place to put them. I said, but what are y'all going to do with all these 15 empty rooms? Well, we're going to take all the COVIDs and put them on one end, and this whole other end of the hall, we're going to designate that regular patients. I said, all regular patients, not COVID? They said, we're going to hold 7 just in case COVID comes back. I said, cool. I got an easier job today. I only got 3 COVIDs today. So the next week, we dropped to like 7 or 8 COVIDs. I said, wow. Out of 38, we're down to 7. I said, where did COVID go? This is great. And they said, yeah, you're going to have more regular patients, cardiac, GI bleeders, stuff like that. I said, great. So next week, we dropped down to 2 or 3. And I said, you got to be kidding me. Something's going on. And that's when I found out that on January the 20th, roughly, the CDC guidelines recommended that we roll the PCR cycling from the high 30s to 28, like it was originally designed to do. And then it hit me. And I lost sleep over it. I was having chest pain over it. And it woke me up in the middle of the night, like hit me hard. I could not sleep. I tossed and turned because my first week or 2 there, I didn't do it. I didn't lead them to the gate, but I'm the guy that euthanized people. They call it comfort care. But when you get to the point
The inventor of the PCR machine, Carrie Mullisk, said, I do not trust Dr. Fauci. He's got nefarious plans for my machine. And then he died mysteriously. Okay, that's the inventor of the machine. And he also said, there are other people that have nefarious plans for my machine. And, anyway, they killed him. And so they could kill me for letting this information out. So I really want you to share it. Crazy, huh?
you can't take high flow off, you get so upset, you ain't seen your family except maybe an iPad in weeks, and you're never going to come off the high flow. And the doctor says, you've done your best. You've done your best. But this is going to be it for you. And so the patients get all teary-eyed and upset, and they call in the palliative team, and they all hold their hand and cry, and they said, but we can keep you comfortable. Here comes Albert. He's got the morphine and Ativan, and I load him up and take off the high flow, and they gasp themselves to death. And I'm the guy that's pushing the button, like in the gas chambers at Auschwitz. No, I didn't lead them there. And honestly, I didn't know what I was doing. I just do what I'm told. It's not my fault. But after January the 20th and then on into February 1st or so, I saw what changing the PCR did on my floor. And then I saw what I had not done for my COVID patients. And then I was also greatly encouraged, don't move them unless their SATs are above 90. Don't move them. I was like,
Kerry Mullis, the inventor of the PCR machine, in a video interview, which I have that somewhere, he said, do not use the PCR machine for COVID testing because you can just turn up the volume and find anything you want. So this is really crazy. You need to share this. And Dr. Fauci needs to be put to death. Did I say that? Yes, I did.
I was like, but I've always been told, get them up and get them going. No, wait till their SATs are high 90s to move them. And I'm like, no, they can tolerate a minute or two down in the low 80s. Get them up, make them move, make them set up, and then they will learn to breathe deeper, and we can wean them off the oxygen. No, their focus was put them on more oxygen. Let them lay in a bed. I said, okay. Then I realized where our mistake is. Yes, early treatments, the HCQ, the ivermectin, real smart. Man, give them at least Tamiflu. But when the PCR cycling changed, I'm telling you, it was a big change on my floor.
That was the one thing that Dr.
According to the
Fauci didn't want you
CDC,
to
according
have.
to DHEC, on their webpage, it says by January 20th, 1.6% of South Carolinians have been vaccinated. 1.6. Go forward a month, February 20th. According to the CDC, they said 7 to 9%. According to DHEC, they got the number exactly. It's 8% of South Carolinians have been vaccinated. But we on our floor saw a 67% in South Carolina. We saw a 67% decrease in COVID cases from January 15th to February 15th. Actually, it said February 3rd was vaccinated, but you're not fully considered vaccinated until that vaccine has been in your body 2 weeks. So that's January 15th to February 15th, 8%. And we had a 67% drop in COVID cases. Yes, COVID's real, but so is flu A. And how many of these COVID cases were really flu with this fake, false, faulty PCR cycling?
Yep.
Cranked up to I don't know what. Fauci even said back in July of 2020 in this Virology Weekly podcast live, he said a PCR over 35 is absolute false. You're not going to get correct data. You're going to be giving out misinformation. He said that back in July of 2020. The CDC.
So you got to wonder what they're turning it up to when they find the pig sick with pig flu and the chicken sick with chicken flu. This needs to be stopped. If you don't go out there and do something soon and share this stuff, you are going to starve because they've already killed a bunch of chickens, and the chickens that we're eating right now are leftover stock from years ago. I mean, seriously, they've been in the freezer for a while. Okay? You're going to run out of food. You better start listening.
He said, crank that PCR up to 40. That's what they did all of 2020 to generate all this giant pandemic and fear that kept me afraid of going in my rooms and doing anything but grouping my care. That's what brought us all this fear. This pandemic is the PCR cycling. I'm telling you, it's the PCR is the elephant in the room. Yes, COVID's real, but we got to jump on this like we've always jumped on upper respiratory infections. And yes, there are early treatments with ivermectin and HCQ. Let me just tell you guys, if I get sick, I am not going to the hospital. Yes, I trust science. I just had open heart surgery, triple bypass, April 5th. But I thought, I'm home, I'm sitting in a recliner, I'm thinking, it's over, it's done, no big deal. Few people die because of their dumbness and determination to make us go down this path to get a shot. I'm out of it though. It's over. It don't matter anymore. And then here comes Delta. The same PCR that was giving us a pandemic in 2020 falsely is the same PCR that took it away when they cut the cycling down to 28 on the 20th, per the CDC guidelines. Now the same PCR that's going to be changed out for a multiplex whatever at the end of this year, the same PCR is now giving us Delta, Zeta, Lambda, whatever. I don't think so. I don't trust them because I know they can't let it go away because Pfizer's got 1 million doses they want to stick to us. 1 billion doses they want to stick to us. For what reason? What's their motive? And what's there any connection between the CDC, CEOs, and Pfizer's? They're switching CEOs back and forth like it's commonplace, and there's no conflict of interest there between the CDC and the FDA and Pfizer or any other big drug companies. And I also know secondhand, information that why did Pfizer get FDA approved? Not JJ, not Moderna. Come to find out, I know somebody on the inside indirectly. They said Pfizer gave the most money to the lobbyists. And what do the lobbyists do with that money? They gave the money to the lobbyists, and the lobbyists lobbied their case to the FDA. And what they're doing with the money, I have no idea. But it's awful suspicious to me that Pfizer gave the most money, and the lobbyists make it happen. And these COVID death shots, I know of at least a couple of people who's paralyzed, waist down. Hope they're getting better. And paresthesia. Look at Senator Ron Johnson's video where he interviews people that have been hurt by the shot. It's happening. People are dying from the shot. I got COVID nurse friends that say, yep, they said they took the shot 2 days ago and they've had a heart attack, they've had a stroke, they have thrombocytopenia, and they get all kind of nerve weird stuff going on. And they die. And a lot just, it's reported to VAERS. I get it. But a lot of people don't report to VAERS. It's not right politics. And I'll tell you something else that was big going on between the COVID I took care of versus my 18 years. Our patients, if they weren't getting better, meaning their oxygen's demand wasn't going down, we weren't weaning that oxygen down because they were resistant to what we was doing, or if we started going up on their oxygen, something's not going the right way. We consulted pulmonology. Pulmonology would go in there and order a slew more tests, usually repeat blood gases, chest x-rays, CTs, and they do a bronchoscopy. I was told back in 2020 when I was at my old hospital, we don't do bronchs on COVID patients. I said, why? We do so many bronchs here. They try to do a bronch on me. Everybody gets a bronch. Just hold your hand up. They'll do a bronch. No bronchs for COVID. Why? Oh, it'll aerosolize it in the bronch lab. I said, okay. Well, I got to Columbia. Yeah, sure enough. I've never heard of anybody getting a bronch. Never. What does a bronch do? It sucks out some junk. They get a culture to make sure they're on the right antibiotic, which sometimes resulted in the doctors going, yeah, it's not staph, it's not strep. It's, in this case, fungal. Switch their antibiotics altogether. But at least cleaning them out, give the antibiotic a foothold chance to get them going. And then, what do you know? We're weaning their oxygen down. It always helped them, these bronchs. We can't do bedside bronchs anymore. We can't do bronchs in the bedside with negative pressure even, with disposable bronch tubes. Nope. No one gets a bronch when you have COVID. That, to me, is the way we used to treat respiratory patients, the way we're treating now.
See, in the beginning of this, I didn't want to put you through the whole thing, but there's a shot called Remdesivir, and that was Dr. Fauci's baby. And anybody that had COVID, he would give them that, and within a week, they'd be dead when they put them in the ventilator because it shuts down all your organs. And there's plenty of proof of that if you want to look it up. But Remdesivir was a killer. It was the AZT that Dr. Fauci made for the AIDS patient a long time ago, where they always said that the cure is worse than the disease. And so Dr. Fauci is a piece of shit. I've known about this for a long time. Yeah, I'm no doctor, but I do keep track of shit. And anyway, here you go. Here's the rest of it. I'm going to play the whole thing, even though I haven't watched the whole thing, because I just knew that I wanted to start recording this because I do have a pretty big fan base. So here you go.
That is murder. Withholding care is murder. When you know better. I didn't know better. I just aided and abetted. But I ain't going back.
Mr. Spence, can I ask you a question, please, and help me? I'm going to ask you two questions.
Yes, sir.
One, help me understand when you talk about the PCR cycling, can you explain
Amplification.
explain PCR for the committee so it's on video and any other members watching at home? Can you explain PCR and what you meant by the cycling and the 28 versus the 35 or the 40?
The PCR polymer chain assay, it's like the DNA testing. They want to find out who killed somebody, right? It's like a DNA test. It amplifies this biological material bigger and bigger and bigger until you can see it and go, oh, there it is. I get the picture now. I see what it is. Well, when you amplify...
But is that a test for COVID? Is that what you're talking about?
The PCR swab up the nose.
Okay, so you swab up the nose. That's what you're calling PCR.
That's correct.
And then when you go to analyze that, that's where the 28 versus the 40 is how much you magnify it. Is that?
Yep.
Please clear that up.
Sure. It's like an overhead projector. You blow things up. Okay. You blow it up a little bit bigger. You blow. They cycle it over and over and over. So they expand it out so they can see what they have.
Okay.
Okay.
And before January 20th, explain that.
The CDC had encouraged the cycling to be up to 40. The original inventor of the thing, okay, the developers, he come out in an interview before COVID come out, and he said Fauci is going to, and his people are going to exploit this. He said anything above 28 cycles is horrible. They're going to exploit it to their own.
But help me understand what it means by what makes it horrible. Is it giving a false positive? That's what I'm trying to bring this down to layman's terms for everybody on the committee and people watching.
False positive.
Okay, so now before January 20th, it's 40,
at 40 cycles.
It's
totally
giving more false positives.
Even Fauci said that in July of 2020. He said anything above 35. Fauci said this. Anything above 35 is complete, bogus, false positive, worthless. And the CDC had it set at 40.
So that being said at 40, let's say we're getting more false positives. What happens to the person with a false positive? If they got a false positive, are they going to the hospital?
And that's why Trump got us out of the CDC and the whatever the other one is, hell anyway, because he realized that was the problem, is the CDC wants you dead. And the, anyway, there's a bunch of different groups out there that want you dead. Here we go.
Well, it
I'm
depends
just trying
on
to understand.
Sure. If a person is sick, okay, they go, I don't feel good, like we've heard today. I don't feel good, I'm going to the doctor. Well, let's see what's going on with you. Well, early on, I have some family members that are doctors. Early on, they would say, okay, you're COVID positive. And they go, well, I feel good. They said, well, you need to go to the hospital so they can evaluate you and watch you, monitor you, just in case you take a turn.
Okay.
So a lot of people initially went to the hospital to get monitored and et cetera, and they're hospitalized. And so
And then they got
what do they
dead.
do when they go to the hospital? They put them into bed. They shut the door, lock the door essentially. They lay in the bed. The horse that lays down stays down. They get to where they do need oxygen. They do get to the point where they do develop hospital-acquired pneumonia. Hospital-acquired, healthcare-acquired pneumonia, HCAP. And so, yeah, now you do have pneumonia after you've been there a week laying in a bed with the door shut, can't see your family, and eating yuck food. Duh, anybody get pneumonia. So you just develop, everybody's got bacteria. So that's how these people initially, a lot of them, in my opinion, would develop pneumonia. They're laying in a bed and they can't get out. But later on, now, a lot of my doctor friends, they're saying, go home on Mucinex, maybe a Z-Pack. Go home, and if you get bad, then come back in. But if they ask for hydrochloroquine or ivermectin, some doctors are starting to give it, even these that I'm speaking of.
Okay, and then help me understand now, when we were talking about the decline in COVID patients, is that coinciding with when the cycling was dropping from 40 down to 28? Is that what you're...
I thought I had COVID, and I had 104-degree temperature Friday when I got out of work a while ago, like a long time ago, during the COVID season. And then I took 2 hydroxychloroquines, and the next day, afternoon, I was back to normal temperature. Shit kicks ass.
Is that what you're telling the
When
committee?
the cycling dropped from 40s down to 28, my sick patients were sick, except we worked with them a lot more. We were in there a lot more. We weren't scared to go in there and feed them. We weren't scared to go in there and get them up in the chair. We worked with them a lot more, and they got out of there. But it's a fear thing. You know, people don't want to go in and die. They don't want to go in and take it home and kill their family members. So they really are backing off a lot. And then you add to it no bronchoscopies for these people. It's horrible.
And you mentioned my second line of question is going to follow. You mentioned RSV. My son had RSV when he was a baby. And we used to have to, my wife and I, even though he went to the hospital, we would give him breathing treatments. Can you explain some of the differences between RSV and a COVID patient, like a real COVID patient, not a false positive? Just from what would be the difference of those two, as far as the lungs would go?
If they're swelled up, whatever it is, okay, whether it's RSV, flu A, anything, bacteria even, everything that's on your lungs that's irritating your lungs, smoke inhalation from burning leaves, everything will make your lungs be irritated. They're going to swell up. It's a natural body reaction. COVID patients that get this virus, it is an inflammatory response in your lungs. They swell up, and that swelling is a perfect breeding ground for bacteria. You need dark, you need warm, you need food, and you need water to grow bacteria. That extra swelling is the water. That's the breeding ground that RSV will be treated, yes, with breathing treatments, yes, with steroids, but they're going to get antibiotics because every doctor knows that's the perfect breeding ground for pneumonia to get started. So they nip it early. So when you come in for COVID, you get treated the same way. You get antibiotics, breathing treatments, and steroids. But the difference is with COVID patients, you get a locked door, you get an iPad maybe, and you don't get patients up in the chair as much. You're not giving them no real physical therapy in that, yes, therapy is a lot ordered, but they're just not working with us.
Right, thank you for that. And Senator Verdon has a question, but I appreciate it.
Yes, sir.
What position in the bed or chair, you're saying you're not getting them up and moving, not getting any physical activity. What percentage in a 24-hour period are they on? Can you tell me whether they're prone? What degree are they? I don't know the terms. Back to stomach.
Most people, when they lay in the bed, they lay flat on their back. Unless we as nursing, who are encouraged to go in there and turn them in position every 2 hours, a lot of time we'd schedule that when they turn in position in case of they had incontinent care. We'd go in to check them for that. And that's when we would turn them while after doing personal care. Now in the units, they have beds that are on auto tilt. And they may go in there even less frequently. They typically manage those patients from the hallway, and the IV tubing goes across the floor, sandwiched between the glass plates, across the room and up into their bed. So they manage all the IV fluids out here and wear a simple flu mask and don't go in there.
What prompted you to leave the hospital setting and go to the in-home treatment setting?
I left ANMED, which was my home base for 18 years, because I saw at least 14 on my unit, regular pulmonary telemetry nurses get COVID. They said, I was positive. I had it. I took my 10 days at home. We did not retest our employees when they come back. They did their 10 days at home of quarantining after being COVID positive. They all come back and they said, I had the sniffles, I had a cough, I had an upper respiratory infection.
So you left the hospital to end care for trying to stay safe, trying to get away from the virus?
I left the hospital because I wasn't afraid of COVID no more. I wanted to go travel nursing and make the big bucks.
Had you ever? Okay, so quite a bit of pay increase.
$120 an hour.
What
compared to 40?
What's your introduction to the committee? How were you made aware of this hearing today? Do you follow the work of the committee?
Well, first, let me say, when I was on the floor at Anderson,
I'm looking for real short answers because I'm trying my chairman's patience.
Sorry. I left the hospital because I wasn't afraid of COVID no more. I saw so many people get over it, so I went COVID nursing. But after COVID nursing, I realized that I cannot go back. I saw too much and so much I disagree with. I just can't go back.
How were you made aware of your opportunity to testify today?
I was sitting on my couch, and my wife said, you know, Delta's here. Delta's back. And I was like, they can't bring it back. They can't bring COVID back. They got the same PCR. They can't bring it back like it was in 2020. Not that big pandemic thing.
Yep.
This is somebody's monkeying with a PCR machine again. And I said,
So there was a notice on this meeting about 4 or 5 days ago. What was your report on this?
My wife saw something on Facebook about a freedom rally at Prisma Hospital in Greenville. People wanting to not take the shot, be mandated to take the shot, nursing staff. And I said, oh, I got to go stand out there with them. And just standing out there with them, even though I'm out of it, even though I'm done, I went out there and said, I got to stand and support these people. This is wrong, making people take a shot or lose your job, which makes you lose your house, etc. You can't nurse anymore.
But you're insulated because you're retired.
Yes, so
right.
I'm not that noble. I'm not going to lose anything. So when I went
Thank
to
you.
that thing, I met a couple of people that said, please come to our next rally. And then they invited me to come here and begged me to come here. So that's how and why. I didn't plan on speaking out. I'm not a public speaker. I'm the bump on a log that never says anything, honestly. And I'm sorry to take up so much of your time.
Well, we've actually enjoyed hearing from the heart and just something that you've actually done, and I really appreciate you being here.
And I got a lot of COVID nurses and friends that are saying the same thing, but they can't speak out because they still have a house payment. And they're really upset about this.
Sad.
Thank you.
Thank you.
They need to be reimbursed.
Since we're going to be talking about preparing for a time of crisis, we have a brand new sponsor.
They all need to be reimbursed big time with Dr. Fauci's money and Nasty Pelosi's money and all these other pieces of shit that were stealing money and making money on the big lie. And if they knew it was a lie, they definitely need to be sentenced and stopped from breathing our air, I guess. Anyway, peace out. This is it. I hope you share this. It was heartfelt. It really needs to get out there, because if you don't, they're gonna use the PCR machine to starve you to death. Soylent Green, baby. That's what they want. Anyway, have a good one.